Hello there, my name is Serge Mucha. I'm a respiratory therapist here at Carolina's Home Medical Equipment. And today we'll be doing an instructional video on this new ResMed AirSense S10 CPAP. Now this unit is quite different from the previous model, so let's look at some of these differences. So this is the device. Notice first thing that I noticed is that humidifier is now built into the CPAP. It's not two separate units, it's one piece. So it's integrated. Here's the humidifier chamber. Comes apart. You take this, open it up like that to fill it up with water. The mark for the level is clearly indicated on the side. Once you fill it with water, still preferably distilled. Clean this same way about once a week or so with mild salty water or vinegar as you prefer. On the inside there's also a power cord and an AC adapter. I'm not going to plug these in because I already have mine plugged in. I'll just put it back in the bag. And it also comes with tubing, of course. It comes with either a slimline tubing, which is just a regular hose that allows pressure to pass through, or as an enhanced option you can have what they call a climate line air tubing. And we're going to turn on the machine, zoom in on the screen. I can show you how those two work differently. So the power cord of the machine plugs in the back here. There's only one place for it. Just take the other end of it, plugs in. And then if you're using the slimline tubing or just a regular tube, both ends are the same. So one end will be attached on the back here. There's only one place for it. And then the other end of it, of course, attaches to the mask. But if you're going to use the climate line tubing, you want to make sure that this end with some electronics on the end plugs in first, because that means that the tubing is controlled by the machine and your heated element is turned on. It plugs in on the top here. You want to make sure that it makes that snap and the tubing doesn't remove anymore, and then you can also swivel it around as it's attached. And just like all CPAP machines, this one has a filter, which is on the side here. You just swing this little door down. It's actually the same filter as the previous model, so if this is a replacement machine for you, you can use the same filters. And it also has an SD card, like they all do. It's just the card here that monitors data for the insurance, for the doctor, and that's really all there is as far as operating the little pieces here on the device. Now let's zoom in on the screen and look at some of these options on the screen. One of the biggest changes with this new device is that they've made everything to be pretty much automatic in every way. Humidifier is automatic. It's auto capable on the pressure. Machine will actually start up and shut off by itself when you put on and take off the mask. And so if you're one of those people who does not want to be involved on the screen, you don't have to do anything at all. You can just put on the mask, machine will turn on and off as you take off the mask. But there are some things you can look at and change if you'd like. For example, on the sleep report, we'll start with that because there's really not a whole lot here. It just shows you your hours of usage from previous night. And remember, the golden standard in this case, of course, is to use it at least 4 hours for insurance purposes. Also shows you if your mask was fitting well, if humidifier was working correctly. In the past, we have had some issues where, since humidifier is automatic, you may not go through the same amount of water each night. So this will just show you if humidifier is working, because sometimes people would wonder if humidifier is even functioning. And so no one's going to ask you to look at this information. You don't have to keep track of any of this data, but it does give you some info on the usage and how well your mask fits. Now under your options, there are some things you could change. If we go in here, you'll notice that now ramp time is auto. Ramp time is a feature that allows you to build up on the pressure from minimum to a prescribed setting. And you can have it in auto mode, where a machine starts on the minimum setting and goes up only as you're already asleep. Or by turning the dial, you can set it to a set setting, like say 35 minutes. Anywhere between 5 and 45 minutes. Or if you want to be on a full blast of pressure, or you just want all that air, you can turn the ramp off, and it gives you your prescribed setting. I would recommend starting that on auto and just kind of working with that. Climate control is also auto. Notice, and the tubing temperature is auto. So if you would like, you can just leave all of this on auto and don't be involved at all. Or you can switch it to manual mode, and then by switching to manual mode, you would have to set the tubing temperature separately from the heat plate setting of the humidifier, because this humidifier, just like them all, has a heat plate that heats up the chamber, and so this number is the heat plate setting, and this is the tubing temperature number. That's if you would want to have it in a manual mode, but I would recommend for climate control to be in auto, have the tubing temperature on auto, and have machine automatically control all the humidity and pressure and everything. You can also tell machine which mask you're using if you'd like. This affects how a leak is being calculated on the report. You can have machine tell you how well mask fits. If you have it all attached, you can run a little mask fit. And notice I'm doing everything with the dial. You push it and dial, push it and dial. I don't press any other buttons. As I scroll through, I highlight it and then go on to the next option. And you can also preheat the system so that when you when you put on the mask, it's already warm and moist for you. You can just highlight this, push the dial, and it will tell you that it's warming. Or you can cancel that and it will be cooling down. And the last thing under your options is airplane mode, which yes, you can use the machine in an airplane if you'd like. But more importantly, this new device has a built-in modem for ease of obtaining data from your machine. It has a built-in modem that transmits data every day on your usage, your mask fit, and so it's an ease of taking care of your pressures and looking at your settings and your hours. But some people feel like their privacy is being invaded because someone looks at their data. So you can enable the airplane mode, and when it's enabled, that disables the transmission of the signal, so no one be looking at your data. But usually people don't do this because the data that it sends out is very basic, and you'll also have access to that data. So that's really all there is on the screen here. Probably the only thing people usually change or mess around with is the climate control setting. If they're not getting enough moisture on the auto mode, they would switch it to manual and kind of tweak the tubing temperature and the heat plate setting. Notice also on the bottom of the screen they've added this home button, and all it is if you press it, it takes you back to the original screen where you can view your options and sleep report. So if you go into your options and you're done with it, you can hit this home button and it takes you back. Or if you're in sleep report and you're done with looking at this data, you can hit that and it takes you back to the original screen. And as I said earlier, a machine will turn on by itself when it detects your breathing. Sometimes, however, people will take rather shallow breaths, or they use a full face mask, and so it takes maybe 10 seconds for it to detect your breathing. If you don't want to wait that long, you can start the machine manually by hitting the start and stop button there. And as it starts up, it displays your pressure setting. Here's what your settings are, 4 to 20. In this case, it's just a demo machine. Your humidity setting, your ramp time setting. So everything is auto, and it displays what current setting you're on. On the top right corner there, it shows you the heat plate is on and strength of the signal from that modem that transmits data. And as soon as you stop the machine, it will display your hours of usage from previous night, your mask fit humidifier function. Also, you start seeing there's a little snowflake flashing there next to the signal strength. That's just telling you that a machine is cooling down humidifier. And if you feel the air, it kind of blows lightly, cooling down humidifier. And it does that for about 30 minutes, and then the machine turns off. And that's really all there is on the screen here, your options and the sleep report. And that's the ResMed AirSense S10 in a nutshell. Of course, there's more to it. There's more little details, like it has a place for a pulse oximetry thing. There's also, remember, this machine has no backup battery. It's strictly off the power from the wall. And there's 2-year warranty on this thing. If something breaks, contact your provider, and usually they can replace the first 2 years. One thing I wanted to mention is under your options, the climate control there, being auto and all, that only appears on the screen when climate line is attached. If this is not attached on the back, you will not see that climate control being auto. You will see just the heat plate setting, and they call it humidity level, and it's just numbers from 0 to 8. And that's used by those who decide to use this regular slimline tubing. It's not heated, so there's really no settings for it. All you do with that is adjust the heat plate setting, not the tubing at all. Also notice that they have this other machine, AirSense 10 for her. It's a machine specifically designed for women. Works the same exact way. The options are all the same. The dials, the filters, all these things are the same. It's a little different color, but ResMed says that with this AirSense for her, women have slightly different breathing patterns when they fall asleep, especially in deep stages of sleep, and so this machine will compensate for that. But it does take same exact filters and same exact climate line tubing and same exact slim line tubing and all the other masks. They're all interchangeable. But it does look a little more feminine, and it has that breathing patterns compensation feature that's different from a regular system one, regular AirSense 10.